everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be dealing with leukemia, which is actually cancer of blood, or we can also say that it is cancer of bone marrow. So basically, leukemia is a malignant proliferation of blood cells, precursors in bone marrow or lymph tissue, and their accumulation in peripheral blood, bone marrow and body tissues. So there would be malignant proliferation of the blood cells, right? And basically, this proliferation, due to this proliferation of blood cells, what would happen? There would be accumulation of these, of these blood cells in the peripheral blood, bone marrow, and in the body tissues. Now here we are saying that it is a cancer of blood cells. Right now we have several cells in our blood, right? We have RBCs, we have WBCs, we also have the platelets, right? So here which particular cell we are talking about? So here we are actually referring to all the blood cells, but mostly in leukemia we can see the white blood cells would get affected. That we would get into a little bit later. Right now, first let us understand about the blood cells, right? So we have got several blood cells in our blood, right? We have the red blood cells, white blood cells, and platelets. Now, what is the function of our red blood cells? Now, you know that, it is very important for carrying oxygen, right? So, our red blood cells carries oxygen to the tissues, to the organs, be it your brain or any other organ. All the organs receive this oxygen from the, RBCs. And then we have platelets, right? So what is the function of platelets? Now, platelets helps the blood to form clot, right? So whenever there is an injury or there is hemorrhage, the platelets helps the blood to form clot, right? And then we've also got white blood cells, right? So what is the function of our white blood cells? Now, white blood cells help us to fight with the infection. So it helps our body to fight with the infection. So you can understand that each of these cells have got their, their own function, right? So the next question is where these cells are made, right? Now, the cells are made in the blood. No, these cells are made inside the bone. So if we look at inside the bone, we can see, it is called as bone marrow. And the cells, the blood cells are actually, these are actually made inside the bone marrow. So if we look at the bone marrow, if we look inside the bone marrow, what we can see that, there are some cells which are making the RBCs, there are some cells which are making white blood cells and also the platelets, right? So these are being made inside the bone. Now in leukemia, what happens? In leukemia, any of these cells start to multiply really rapidly. So what would happen? Any of these three cells, that is, might be the, the red blood cells or the white blood cells or perhaps the platelets. Any of these three cells would start to, multiply rapidly. So there would, there would be increase in number in any of these three cells. Now, in most of the leukemias, we can find out that it is, the WBCs are affected. As I mentioned earlier, that white blood cells would be affected. But it is not certain that, the platelets or the red blood cells cannot get affected. Now, there are certain leukemias where we can see that the red blood cells also might get affected or the platelets might get affected. But in most of the major cases, what we can see is that there would be, the white blood cells would get affected, right? Now, so here we would talk about, considering the fact that there would be the white blood cells would get affected, right? So if we consider here that the white blood cells would get affected, so what would happen at this stage? There would be increased, or there would be, WBCs would be increased in numbers, right? Now, the problem here is that the leukemia cells, do not serve any function. And then the second thing is, if one of these cells start taking up a lot of space, then what would happen? That would leave behind very little space for the other cells to grow. So one thing is, we are having lots of blood cells which aren't serving any function, right? And the second thing is, there are a lot of blood cells which is taking a lot of space, and for that we don't have enough space for the other cells to grow, right? So for example, if we consider, there is, the WBCs are more in number, right? So these WBCs aren't serving any function, right? It won't help you to fight with the infection. And the second thing is, it will take a lot of space, that your RBCs or your platelets won't get enough space to grow. So that's what happens in leukemia. Now next, let us move on to the definition of leukemia. So leukemia can be defined as a type of cancer of the blood or bone marrow which is characterized by an abnormal increase of immature blood cells. So here also one more thing is that the cells, when it starts to multiply rapidly or divide rapidly, the cells what we get, the product would be an immature cell, so which we call it as blast cells, right? So these cells are actually immature cells, and that's the reason it won't serve any function. So we can say that leukemia is a blood cancer, or also it is a cancer of the bone marrow, because the abnormality or the deviation which is happening, right, that is happening inside the bone, in the bone marrow, right? So we can also call it as a cancer of bone marrow, where we can see a lot of abnormal increase in the immature blood cells. So normally, if we look inside the bone, we can see there would be very few amount of immature blood cells, only 2 to 3% probably. But here in leukemia, what happens, the number of immature cells are quite higher. It is 3 to 4 times more than the normal one. So basically in leukemia, we can see a lot of immature blood cells inside the bone. So we understood that in leukemia, there is abnormal multiplication of cell is happening, right? Now, what might be the cause? So next, let us move on to the causes of leukemia. So the first thing can be, there might be chromosomal translocation. So if there is translocation of chromosome, that also might cause sometimes leukemia. And if there is exposure to carcinogens during pregnancy, so if the pregnant mother gets exposure to carcinogens, then again there is a chance that the child might get affected with leukemia. The third thing can be if there is any congenital disorder. So for example, if the child is affected with Down syndrome or any sort of congenital disorder, in that case there is again the chance is higher to get affected with leukemia. So next, moving on to the classification of leukemia. Now we can classify leukemia based on two factors. The first thing would be how immature the cells are. So we are constantly talking about the immature cells, right? We are saying that in leukemia there will be immature cells inside the bone, right, in the bone marrow. Now, how immature the cells are, based on that we can divide or we can classify leukemia. And the second thing could be about based on the type of cells. So the first thing we would look into based on the how immature the cells are. So we can classify leukemia into two types, that is acute and chronic. So acute leukemia actually happens very suddenly. It doesn't take prolonged time to occur. It grow very rapidly. So the cells also grow very rapidly, and the second thing is that it grow from the most immature cells. So if we compare between the acute leukemia and the chronic leukemia, we can see that acute leukemia occurs from the most immature cells. And as it grows from the most immature cells, the cells bear no resemblance in appearance or in function to the mature specialized cells, because in acute leukemia the cells would be really immature. Whereas if we see about chronic leukemia, and that we can see the cells are little bit more developed cells, and also the chronic leukemia happens over a long period of time and it grows very slowly. Next is according to cell type. So according to cell type, we can again classify leukemia into two types, that is myeloid and lymphoid. So for example, again in myeloid we have different cells, that for example erythroblast or megakaryoblast, and for lymphoid again we have different types of cells, that's lymphoblast and lymphocyte. So these are the classification or types of leukemia, we can say. Now next thing is, let us move on to the classification. Now before discussing about the classification, let us again go back to the fact that what happens in leukemia, right? So we understood that the cells start to multiply rapidly, right? And it would serve no function, and also it would take a lot of space, and for that the other cells won't have enough space to grow, right? So till here we learned. Now that means the cells would get accumulated inside the bone, right? So inside the bone marrow there would be accumulation of these immature cells, and there is increased number in these cells, right? So for example, we were talking about the WBCs, right? White blood cells. So if we consider the white blood cells again, now here we would have this accumulation of the white blood cells inside the bone marrow. Now that's how the leukemia would start to spread, right? Because it would, when it won't get enough space to get accumulated there, it would start to leak into the blood. So the child will have several signs and symptoms, right? So let us move on to the clinical manifestations now. Now here, the first thing that we can see, there would be weakness, right? Now why weakness? Because we know that the red blood cells are very important for carrying oxygen, right? Because the red blood cells, in that we have hemoglobin, and that carries the oxygen, right? So if there is less red blood cells, then definitely the child won't get enough oxygen. The tissues and the organs won't get enough oxygen to get energized, right? So definitely there would be weakness. The second thing would be fatigue. Again, what is the reason behind fatigue? Because the child would have less oxygen, right? Now, when there is increased in number of WBCs or increased in number of platelets, and the RBCs are less, and even if it is the RBCs gets affected, then you can think of that there would be the RBCs would be increased in number, right? But that won't, remember, that won't serve any function. The leukemia cells won't serve any function, right? So eventually, whether be it any kind of cells, the healthy cells, what we are going to have would be less, right? So these cells would actually serve function. Now these cells are actually less. So definitely the child would have fatigue. And again, there would be shortness of breath. So again, the reason is same, because the child would, won't get enough oxygen for the tissues and the organs. So the child would start to breathe faster to, compensate that, that lack of oxygen. And because of that, there would be shortness of breath. And the next thing is there would be pallor. Now why pallor? Because we know that the color of the red blood cell is actually red, right? So when there is lack of red blood cells, then definitely there would be pallor. And then also there would be prolonged bleeding. Why prolonged bleeding? Because again, there is lack of platelets, right? So there is lack of healthy platelets. Now, we know the function of platelets, right? It helps in blood clotting, right? So if there is lack of platelets, then again there would be prolonged bleeding. Also, the child will have easy bruising. So when you are, when you are assessing the child, you can see that there would be easy bruising. Now, as we are saying that there would be lack of RBCs, lack of platelets, likewise, there would be lack of WBCs also. Now, remember that even if the WBCs gets affected, there would be the WBCs would be increased in number, right? But here we would have very less healthy WBCs, right, which would actually serve any function. But the leukemia cells would not serve any function. So we have to consider here that the healthy cells, how much healthy cells we have, right? So definitely there would be lack of WBCs also. And if there is lack of WBCs, what would happen? There would be frequent infection, because we know that the function of WBCs is to help our body to fight with the infection, right? So when there is lack of WBCs, the body won't be able to fight with the infection. So there would be recurrent infection, and the child will get infection very frequently, and they will be more susceptible towards infection. Next is there would be weight loss. You can see a significant weight loss in the child. Also, there would be bone pain. Now, why bone pain? Because there is accumulation of these blood cells are happening in the bone marrow, right? And there are sensitive neurons, right? So because of that, the child will have bone pain, and also there would be nausea there, and apart from these things, there would be vision change and constant tiredness. And constant tiredness is because of the lack of oxygen that the child is getting. So these were the clinical manifestations. Now next, let us move on to the diagnostic test. So in diagnostic test, the first thing that we would see would be complete blood count test. So in diagnostic test, the first thing that we would do would be looking into a complete blood count test. Now this test would tell us what is the number of RBC, WBC and platelets, right? So here it's very important to know about that what is the number of these particular blood cells, because that would tell us that or give us a hint that if it is a type of blood cancer. Right. Now, in complete blood count test, we can find out that there would be decreased in the red blood cells, also the hemoglobin, hematocrit and the platelets values would be low or decreased. Also, sometimes we can find out that the WBCs would be decreased, but most of the time we can see that there would be increased in the WBCs. Why? Because most of the leukemias, in most of the leukemias, the WBCs would get affected, right? So if it is, if it is a type of leukemia where there is the WBCs are affected, then we can find out that there would be increased in the WBCs, but definitely there would be decreased number of mature WBCs, because remember here the leukemia cells would be immature, right? So definitely we can find out that there would be decreased number in the mature WBCs. And the next thing we can do would be bone marrow aspiration. So basically in bone marrow aspiration, we look into, inside the bone. We look into the bone marrow and we see how the production is happening, right? Because we know that all these blood cells are made up inside the bone, right? In the bone marrow. And the problem what is happening in leukemia is actually happening in the bone marrow, right? So we have to look inside the bone marrow to understand what type of leukemia it is and whether it is a case of leukemia or not, right? So we can find out that it would be a hypercellular bone marrow. Now what do we mean by hypercellular bone marrow? Now here there would be accumulation of these leukemia cells, right? There is increased number of these blood cells, and which would get accumulated inside the bone. So bone marrow, which is filled with a lots of blood cells, it's called as hypercellular bone marrow. So first thing we can find out would be hypercellular bone marrow, and the second thing would be there would be increased blast cells. That means there would be increased immature cells. Now as I mentioned earlier that for normally if we look inside the bone marrow, we can see that the number of immature cells are very less. But in case of leukemia, the number of immature cells are very, very high. It is almost 3 to 4 times more than the normal one. So that is how it is diagnosed. Now next let us move on to the management. So in management, basically the first thing that is used in the management of leukemia is chemotherapy. So there are basically three phases in chemotherapy, right? So the first phase is induction phase, the second phase is consolidation phase, and the third phase is maintenance phase. Well, so basically what we do in chemotherapy is that we inject chemical to kill the cells, right? To kill the leukemia cells. So here, as I told you, that there are three phases, right? The first phase is induction phase. Now this induction phase lasts for around 4 weeks, and the goal here is to kill as many cells as possible. The second phase is consolidation phase. Now in consolidation phase, what we do is basically, here our goal would be to kill any leukemia cells which has left behind, right? And also we have to stop the or we have to prevent the spread of leukemia cells to brain. Now in the first phase itself, that is induction phase, we would kill as many as leukemia cells we can kill, right? And in the second phase, in the consolidation phase, there might be some cells which are left behind, right? The leukemia cells which are left behind. Now these cells actually can travel to the brain, and then it can spread to the brain. So we have to prevent that. So in second phase, basically our main goal is to kill any of these leukemia cells which are left behind, and also we have to prevent the spread of these leukemia cells to the brain. And the third phase is maintenance phase. So maintenance phase actually lasts for 2 to 3 years, and here our goal would be to prevent it from coming back. So if any leukemia cell comes back, our goal here in maintenance phase is basically to kill that and to prevent them from coming back. Now apart from this, we can also use radiation. Now remember, radiation is not used for children who are below 5 years of age. Why? Because in this age group, their brain is rapidly growing. So if you if you give a radiation at this stage, it might disturb the cognitive development. It might disturb the growth of the brain. So because of that, children who are below 5 years of age, for them radiation is not used. Apart from this, there is also surgical management. Now, in surgical management, we can basically do bone marrow transplantation. So, if we can find a donor who would be matched with the with the patient, then we can go for bone marrow transplantation, where the faulty bone marrow would be replaced with a healthy bone marrow, which would produce healthy blood cells. So that is a surgical treatment. Now next, let us move on to the nursing management. So in nursing management, first we will talk about the nursing diagnosis. Right now, in the nursing diagnosis, here we will talk about the nursing diagnosis and the related factor, and you can add the evidence factor based on your patient's condition, right? So first thing, we can say that there would be acute pain, because we learned that the child would experience pain, right? So acute pain related to bone marrow packed with leukemic cells, because these leukemic cells are accumulated there, and because of that the child will have pain, right? So there would be acute pain. The second thing could be risk for infection related to inadequate primary defenses, because the WBCs are not healthy. There aren't enough WBCs to fight with the infection, so the child will have recurrent infection, right? And that's the reason the child will be vulnerable to infection, or more susceptible to infection. So there would be risk for infection. Next thing would be risk for deficient fluid volume related to hypermetabolic state. And also there would be activity intolerance related to imbalance between oxygen supply and demand. So you know that there aren't there won't be enough oxygen reaching to the tissues and the organs, right? So the child would be tired, there would be a constant tiredness, the child will feel weak, and because of that there would be activity intolerance. Next, let us move on to the nursing intervention. So what are the nursing interventions that you would consider when you are taking care of a child with leukemia? Right? So the first thing would be infection. Now we know that these children are more susceptible to infection. So first thing is that you have to assess if there is any signs and symptoms of infection, and the next thing is you have to prevent infection in these children. So you have to practice aseptic technique whenever you are doing any sort of procedure. Also, you have to make sure there isn't any cross infection happening, and whenever you touch the patient or you contact with the patient or any other infectious patient, you have to make sure that you follow proper hand hygiene. And along with all these things, you also have to make sure that you educate the parents how to, how to recognize the signs and symptoms of infection. For example, the child will have fever, the child will have chills or cold and cough, and these things would, tell us that if the child is having any sort of infection. So you have to, educate the parents also about that. Next is prevent bleeding. So you have to, explain to the parents that why the child is more vulnerable towards, to bleeding, and if there is any easy bruising or there's bleeding, you have to provide ice packs. So you have to apply pressure, and you have to stop the bleeding. Next is promote good nutrition. So here, as you know, the child will be taking chemotherapy, and that would also cause significant weight loss in the child, and there would be anorexia also. So you have to make sure that the child is taking high calorie food, and also the food which would provide a high protein, right? And about that, you have to make sure that the parents also understand about that. So you have to make sure that the child is having good nutrition. And next thing is education. So you have to educate the parents about the disease course, and the treatment and the adverse effects. And along with these things, you also have to make sure that you educate the parents about follow-up. So if the child completes chemotherapy for 2 years without relapse, then you have to stop chemo and follow up. And if no relapse within 5 years, then you can then the child can be declared as cured. Well, so these are the nursing interventions that you can consider while taking care of a child with leukemia. So that's all about today's class. So let us conclude our today's topic here. So today we learned about leukemia, which means actually cancer of blood, or we can also call it as cancer of bone marrow, where we can see there would be multiplication of blood cells in the bone marrow. So I hope you have got a better insight about the topic. Thank you.